Okay.
Could you tell me, just for my knowledge, are there folks who are like watching this that we can't see because we're the presenters?
Exactly.
Yeah.
We're promoted people.
Okay, thank you.
We're special.
Appreciate it.
Okay, one more minute. And it's not only streamed and recorded, so it's here for posterity. Something else. Okay, we can begin.
Sounds good. You're streaming and you're all set up.
Great. Okay, good evening to the May edition of Health and Human Services Committee of Community Board 7, Manhattan. You may or may not be aware that May is Mental Health Awareness Month. I think since 2013, I believe President Obama initiated it, but it had been brewing for a long time. So the issues of mental health are not new, but there are nuances to it, and I think fair to say increases that we documented a couple of months ago when we had our mental health meeting and our suicide awareness meeting following month. I just want to give a little overview of, before we start, of the reason for mental health awareness and some feeling for how important it is. So there's a National Alliance on Mental Illness, known as NAMI. It states on its website that each year, millions of Americans face the reality of living with a mental health condition. During the month of May, NAMI and the rest of the country are bringing awareness to mental illness. Each year, we fight stigma, provide support, educate the public, and advocate for equal care. Okay, just some facts that 1 in 5 American adults experience a mental health issue, and that's those who admit it. Suicide is the 10th leading cause of death in the United States. It accounts for a loss of more than 38,000 American lives each year, more than double the number of lives lost to homicide. Less than 20% of children and adolescents with diagnosable mental health problems receive the treatment they need. Early mental health support can help a child before the problems interfere with other developmental needs. The vast majority of people with mental health problems are no more likely to be violent than anyone else. Most people with mental illness are not violent, okay? And I think that's an important fact. And only 3% to 5% of violent acts can be attributed to individuals living with a serious mental illness. And lastly, half of all mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders begin before age 24. So it covers childhood to all ages, every segment of the population, all human beings that live in our society and our community. We are fortunate tonight. First, when we had our mental health meeting, we came up with 8 requests, okay, of things we thought were significant and could make a difference. So we're certainly looking at those tonight. I'm going to project them, but before I do, we're very fortunate to have people with us who can be helpful because they represent different governmental levels. First, from the mayoral level, we have Erin Kelly, who's a senior health policy advisor to the Deputy Mayor for Health and Human Services. We're going to, at 7:30, have the Honorable Mark Levine, the Manhattan Borough President, who pointed out to us that Manhattan Borough President, although he's not in a legislative body, initiates legislation. And from the Honorable Sean Abreu, City Councilman from Manhattan District 7, which is a part of us. Now, who I thought Amber was going to be here. Who is here? Is it?
Yeah,
Amber,
that's
Amber
me.
is here. Good. Okay.
I'm Councilmember Abreu's Chief of Staff.
Okay. The Chief of Staff, which is very fortunate because she has a reputation for knowing everything you need to know. So we're very grateful to have you here. I just want to project for a minute. Let's see. Shared screen. Let me see if I can do it. Now, is the screen shared?
You'll just want to press, Shelly, it's Max. You'll just want to press where it says share screen. It should be like a green button towards the bottom.
Yeah, I know how to do it. I'm an old hat at screen sharing. I had it, now I lost it, but I will get it again. Is it on now?
Yes.
Yes.
Oh, it is, good. Okay. Let me just get rid of this. So I'm not going to read the whole thing, I'm just going to give you the highlights. So we wanted the mayor and the city council and different levels of city government to reverse and state really, to reverse the closure of inpatient psychiatric beds, to expand mobile mental health crisis response teams, to increase crisis stabilization centers, which are known also as living rooms, build more supportive housing with mental health services, embrace and expand the clubhouse model of rehabilitation, revamp discharge planning for formerly incarcerated New Yorkers, something we've looked at over the years, so very serious, increase school-based behavioral health, and redirect Thrive New York funds. They were, from our knowledge, $250 million that was at least available. Some people said a lot more, but that's what we could discern. So let me come off it. Now, how do I remove it? Here. Yeah, okay. So we're going to begin with Erin Kelly, and we appreciate your being here. And I'm sure this is the way you wanted to spend your evening.
Hi, everyone. Thanks so much for your time and for listening to us in the administration about our priorities in this. I'm actually going to turn it over to my colleague to do the bulk of this conversation and presentation. Jason Hansen is one of the co-acting directors of the Office of Community Mental Health and has been in this field for some time and will kind of speak to some of the specific programs that we're doing. I'll say that just off the bat, the area of mental health is, broadly a huge priority for the mayor, something that's really important to us, something that we see is deeply tied to the COVID or the pandemic recovery at large and deeply tied to doing that in an equitable way. And there is no pandemic recovery without kind of consideration for mental health. And there is no way to achieve equity in this city without, deeply addressing the mental health challenges that we all face. So I will, with just that very small preface, we'll turn it over to Jason to get kind of more into the weeds about stuff that we're doing.
Thanks, Aaron, and thank you all for having us both today. I'm also going to share my screen and give a quick presentation. So bear with me for just 1 second. Okay. So I want to talk a little bit about the mental health crisis support in your community. So as Aaron mentioned, my name is Jason Hensman. I'm one of the acting co-directors of the Mayor's Office of Community Mental Health. And our office is charged with overseeing strategies to fill critical gaps in mental health care so that every New Yorker in every neighborhood across the city has the support that they need. And today I'd like to walk through a couple different topics. So I want to talk about how every New Yorker can get help quickly. I want to talk about Be Heard, which is a pilot initiative. It's actually referenced in the bullet points that you all just showed, which is that pilot program in Northern Manhattan. And then talk about some of our responses in the city, such as NYC Well, 911, 311, and where else folks can get support. And then talk about crisis ongoing care, and then answer any questions you all might have. But let's get started, and we'll talk a little bit about how to get help quickly. And if you take away nothing from this conversation, one of the key takeaways should be where to call to get help, and where to call to get help if you're looking for mental health support is NYC Well. So that's 1-888 NYC Well, where you can get connected to trained professionals, to peers, and they can connect you to resources in the community. They can also, and I'll talk about this in a little bit, they can connect you to mobile crisis teams to get really in-person support quickly in the community if you're facing a mental health crisis. The other numbers that you can call is 311 if you're experiencing, or if you see someone who is experiencing homelessness, or 911 if you know that someone's life is in imminent danger. And I'll talk a little bit about the distinctions between 311, 911, and NYC Well just a little bit later on. But I do want to talk about this new pilot that we're doing in Northern Manhattan. So this Be Heard pilot, which stands for the Behavioral Health Emergency Assistance Response Division, is New York City's health-centered response to mental health emergencies. So Be Heard teams are health-only teams that include 2 EMTs and a paramedic, or a paramedic and a social worker. And our goals are to really route 911 calls to a health-centered response wherever it is appropriate to do so, and to really increase community connections to care. So really ensuring that folks are getting connected to care in the community, and reducing unnecessary transports to the hospital and unnecessary use of police resources. So these teams have the expertise to respond to a range of behavioral health problems, such as suicidal ideation, substance misuse, and mental illness, including serious mental illness, as well as physical health problems. So they can assist on site, take people to community-based care locations, and recommend a hospital if needed, and really offer follow-up care if that is what's needed. And Be Heard teams are assigned by trained EMTs based on location, circumstances, need, and availability. And as always, callers can describe the situation and need when they're speaking to call takers. So we started this in Northern Manhattan in the 2-5, the 2-8, and the 3-2 precincts back in just about a year ago, back in June of 2021. And now we're in 9 precincts across Northern Manhattan and part of the South Bronx, including Harlem, Washington Heights, Inwood, and parts of the South Bronx. And they can respond to 911 mental health emergencies that do not involve a weapon or imminent risk of harm or immediate need for an ambulance. You'll notice, because I noticed this obviously before I got on here today, that you all aren't part of the pilot. So this is more for awareness at the moment, but this is something that we are continuing to expand over time. And you can imagine, you know, the all the effort that kind of goes into kind of making these changes to the citywide system. What I do want to talk a little bit more about is, you know, we are expanding some more to the 40th and the 41st precinct, more in the South Bronx. And, you know, in the next fiscal year, we're looking to expand to Central Brooklyn in Eastern Queens and be in more than 11 precincts. So what I'll say about the data and what we're seeing in this pilot is we're seeing that, you know, about 22% of 911 mental health calls are being routed to Be Heard teams. And we're really working to increase that number. But what we're seeing in the actual outcomes is we're seeing that more folks are accepting help. So 92% of folks are accepting help versus 87%. We're seeing fewer hospitalizations, so 46% versus 87%. And these numbers, the comparison is for the traditional response of an EMT and an NYPD police officer. We're also seeing more options for community-based care. For the traditional response, the only option is transfer to the hospital. But for Be Heard, we're able to serve 28% on site, and we're able to transport 19% to community-based locations. And importantly, we're making sure that everyone gets follow-up care so that we can prevent the next mental health crisis. So all that being said, I do want to circle back to NYC Well, you know, and talk a little bit about, you know, a mental health crisis, which is a situation in which a person experiences an intense behavioral, emotional, or psychiatric response that may or may not be triggered by a precipitating incident. Exposure to trauma, to violence, substance misuse, and serious mental illness can all lead to a mental health crisis. And if you or someone you know is experiencing mental health crisis, NYC Well can help. You know, NYC Well can provide support before, during, and after a mental health crisis. And counselors can provide immediate help, connect you or the person you need to ongoing care, or send in-person support if necessary. And when you reach out to NYC Well, you'll be connected to a trained counselor or peer support specialist, someone with lived experience with mental health or substance use challenges, who will listen and support you. And importantly, services are free, they're confidential, and they are offered regardless of insurance or immigration status. And we have translation in more than 200 languages. So if you need in-person support for an urgent mental health crisis, you can ask for a mobile crisis team. So these are teams of clinicians and peers that can arrive within 2 hours between 8 and 8, 7 days a week, and really assess the situation for the most appropriate intervention. Again, they're staffed with a clinician, with peer support, and really work together to provide mental health services to children, to adults in their homes and public spaces. They can provide behavioral health support, de-escalation, assessment, connection to ongoing mental health and substance use, and other types of support. And importantly, insurance is not required to receive to receive mobile crisis team services, but it can be billed for folks that do have insurance coverage. And to access a mobile crisis team, again, going back to what I said at the beginning, you can call NYC Well, so 888 NYC Well, or text Well to 65173, or you can chat online. But let's talk a little bit about 911. So shifting gears a little bit, thinking about the 911 system. So 911 is really meant for this immediate emergency type situation. So if a person is at immediate risk of hurting themselves or others, or is in imminent danger of becoming, or imminent danger because of a health condition or other situation, right? So not all mental health services or crises require an emergency response. If you're not sure what kind of services that you need or that someone needs, call NYC Well. And that trained counselor can really talk you through and really help determine the most appropriate next step, including connection to 911 if appropriate, or the full array of the city's mental health services, to include those mobile crisis teams as well. In all mental health emergency situations throughout New York City, NYPD officers and EMTs can arrive within minutes to assess need and ensure public safety when needed. And first responders can transport people to the hospital for further care and assessment. And as we discussed in the 9 precincts in Manhattan and in the South Bronx, BHERD teams might be respond instead of PD and EMS based on need, circumstance, and availability. So you should always call 911 if you can, but there is a text option as well. So you can text 911 if you need to, and it's a reliable and safe way to reach emergency services in New York City. And text to 911 can benefit the deaf, people with hearing loss or speech disabilities, and those who can't safely call 911. Text to 911 is free, works through SMS with cellular carriers, and requires a text or data plan. And text to 911 is available in English and Spanish throughout the 5 boroughs. Shifting gears a little bit to talk about 311 and their suite of services, and particularly on the homeless side. If you see someone in a public space and you think that they might be homeless and need urgent attention, you should call 311 and request a street outreach team. And experienced outreach teams from nonprofit service providers who engage people experiencing street homelessness wherever they are on a case-by-case, person-to-person basis, working to help people move into transitional and permanent housing. And street outreach teams, they can provide immediate assistance, transportation to shelter and services to include drop-in centers and safe havens, ongoing case management, and assessment for medical or mental health crises. Helping someone off the street can take many contacts by these outreach teams who engage New Yorkers 24/7. Insurance is not required, it's not billed, and you can contact 311 by phone, text, or via the mobile app. So let's talk about who else you can call and where else you can get crisis services here in New York City. So we have many services that are available to support New Yorkers experiencing or who are at risk of experiencing a mental health crisis. These services and locations are available following an assessment and referral by city agencies or other health providers. So crisis respite centers, for instance, are warm, safe, and supportive alternatives to hospitalizations for people experiencing an emotional crisis. It's really, it's led by trained peers and non-peers providing support, including psychoeducation, social support groups, self-help training, recreational activities, and linkages to medical and psychiatric providers. And information about Manhattan crisis respite centers, you can find on NYC Well, and we can put in the chat as well in a how to help guide I'll actually reference in just a little bit. The other thing I'll mention is the East Harlem Support and Connection Center. And this is one of the new models we're also working on within OCMH, which is this behavioral health and substance use service center in East Harlem for New Yorkers. It's including screening and assessment, counseling services, peer support, and connection to ongoing health and social care. And the center can really help with both immediate needs, including shower, laundry, food, and offers overnight stays as needed. And this is really based on what NYPD officers and BHERD teams are seeing when they're out in the field, and they are the primary referral source into these support and connection centers. You can't walk into the centers for services, but once you're admitted and once you're referred by NYPD or BHERD, guests can return on their own for additional support. And I also want to talk about hospitals and psychiatric, comprehensive psychiatric emergency programs. So hospitals across New York City can help stabilize folks who are really experiencing that acute psychiatric symptoms. During an inpatient stay, physicians, other mental health professionals establish a diagnosis and begin that treatment plan. At many hospitals, social workers will meet with the patient's family, create discharge plans to really ensure that patients have a safe place to continue treatment after leaving the hospital. And to find out if a hospitalization may be needed, psychiatric emergency programs, so comprehensive psychiatric emergency programs, or CPEPs, are available in every borough. And information about how to determine about when a hospitalization is necessary. That is, a great role for NYC Well, and really talking to those counselors. So we're almost done. I think this is one of my last slides, and this is about finding that ongoing care and really trying to prevent that next crisis. So New Yorkers who are at risk of crisis may benefit from ongoing behavioral health care. There are services that can help you or someone else connect to support, and NYC How Well can really help you find that right provider. Again, regardless of insurance coverage, using an extensive database of behavioral health providers in New York City. You can also call them and you can ask a counselor to help really find that right provider as well. And you can explore their provider directory, which is online, nyc.gov/NYCWell, and just click on Find Services. The other thing we have in New York City is NYC Care, which guarantees low and no cost physical and behavioral health services to all New Yorkers. And New Yorkers who don't have insurance can call 1-646 NYC Care to enroll. And then clubhouses. These are member-run supportive communities for folks who have a history of serious mental illness or substance use. Free services include mutual support from other members, professional staff support, work training, educational opportunity, and social connection. And you can find clubhouses again on NYC Well. And we also have a how to help guide. And I'm going to put this in the chat. It's on our website that really gives a comprehensive look at what you can help folks find in the community for mental health. We realize the mental health system can be daunting at times and it can be confusing in the best of times, but we created this guide to really help people navigate this system just a little bit better, to find both, crisis support, but also continuing support and preventive care. So again, going back to, what I mentioned at the beginning, if you need help, call NYC Well. There are trained professionals on the other end. There are counselors, there are peers that can really help folks get connected. And you can also get in-person support. If you see someone who might be experiencing homelessness, you can call 311 to get a mobile outreach team. And if someone's life is in immediate danger, if you feel like they're going to hurt themselves, someone else, you should call 911 to get the appropriate response. So I'll put the link to the how to help guide in the chat, but I'm happy to answer any questions you all might have.
Okay, let's go back. I just want to check with Max or Jesse. Is the borough president here yet?
No, I'm not seeing anyone. Although I'll just make a general announcement. If anyone is here in the attendees pile from the borough president's office, just raise your hand and we'll promote you.
Okay, thank you. Thank you, Jason. Just want to point out that the New York City NYC Well, I actually used it. We were doing a Thrive New York training, mental health training, went out for lunch, and the way back, there was a woman on the street who I'd seen before, and she was crying terribly.
Wait, Shelley, I'm so sorry to interrupt. Actually,
Yes.
Just as you're saying that, we have someone from the borough president's office signing in.
Great. Okay, give me a second. I will
Sure.
finish the story because I think it's demonstrative of how effective it is. So to make a long story short, finally, she didn't want anything. She needed to talk. She explained that her partner had died and the parents did not want her to attend the funeral. And she was distraught and she didn't know what to do. And that day was the funeral. So I happened to have from the training the NYC Well card. And I said, I told her, I can talk to you for a little while here, but I think there's someone who could really be helpful to you. You have a phone. I said I would go home, I would sit quietly, and I would call this number. When I ran into her, it was so effective. They were on with her for an hour, okay? And really what she needed that day, she said, and she now has a contact there, okay, to follow up. So it's not just something to talk about, something real. We're going to turn to the borough president if we can come back for questions if you're available, okay? Because who is here from the, also we have our chair has arrived, Steve Brown, amongst others. Who is here from the borough president's office?
I believe I saw Eric.
Oh, hi. Hi,
How
Eric.
are you?
Okay, good
Hi,
to see
everybody.
you.
Good to see you as well.
Okay,
I can double check to see what the borough president's timing is. I think he should be here shortly, though.
okay. Let us know.
Great.
Always good to see you.
Likewise.
Okay. So let's proceed with any other questions that people have. I have a few. Anybody else right now? Okay. Is it possible to get a list of all these contacts, which we could possibly put on our website? Because many people go there for resources or to give resources to other people. Is there any document? Is there any pamphlet? Is there anything like that you could provide for us?
Absolutely. So I was trying to find the chat, but it looks like there's no chat here. So I can't put it in the chat. But what I can do is follow up after. We can send some of our how to help guides to the district office. We can send them via email, and they're really meant to be really just a half-page kind of pamphlet to find really the information you're needing based on kind of what folks are experiencing. So I'll have someone reach out to you all to get you either physical copies or digital copies.
Okay. Is the mayor, I guess he'd be advocating on recommendations from the office of mental health. What's that? Of mental health, that is he advocating for any specific programs to address the mental health situation? Evidently, he's supporting these initiatives. Are there any other initiatives? As he had mentioned, he wanted to do other things in his various addresses. Are you aware of any of those specific things?
Yeah, I'll get started, and then I'll let Aaron fill in any blanks. But I'll mention a couple, I think, very, very big, or maybe not very, very big, but big initiatives that the mayor has done just in his first couple months in office. And I'm going to start with the subway safety plan. So I think recognizing the intersection of homelessness and mental illness, and how important it is to get folks support where they're at. He announced this subway safety plan to bring additional resources into the subway. So this includes additional support from Department of Homeless Services, additional support from DOHMH, which is our Department of Health and Mental Hygiene, to really meet people where they're at and get folks connected to care and services, but also look at the system writ large and how we can do things better. How can we make better connections? How can we use the resources that we have in better ways? So that's part of the subway safety plan. Part of the subway safety plan also was expanding the Be Heard initiative. So we talked about that police response to mental health crisis. So he announced an expansion as part of the subway safety plan, and furthered that investment as part of the executive budget for FY23. So really expanding that, out of Manhattan and the Bronx into, in the future fiscal year into Queens and Brooklyn. So those are, I think, some of the bigger things that he's announced around mental health. Aaron, I'm not sure if there's other things you might want to add as well.
I just would throw out that just as a first point of, I guess, like clarification, is that Jason's office and the Office of Community Mental Health is, within the mayor's office, within the administration. So, their priorities are the mayor's priorities. They're one and the same there. And that in addition to the work that we're doing around folks with serious mental illness, a lot of which Jason spoke to, we've also been talking a lot about what we can do as a city around children's mental health, which is something that we didn't really touch on, but is a huge thing that we need to be thinking and talking about, especially coming out of the pandemic and how tough that's been for all of us, and especially our youngest New Yorkers. And then the other big thing that we are trying to do work around is around substance use, and especially the overdose crisis. Again, that is not exactly the same as mental health, but we know that so much of substance use has a root in some sort of pain, which may, come out of a mental illness or come out of a trauma. And so those are the other two pieces of the puzzle that we're super focused on right now as well.
Thank you.
I might mention just two other things real quick. Sorry. We just announced a new initiative just yesterday called Connect, which is really meant to, expand our capacity in outpatient clinics. And really, again, with that idea of meeting folks where they're at in the community. I'll also mention our Commissioner of Health today, Dr. Vassan, gave a speech around his priorities around mental health. Again, reflective of, I think, this mayor's deep commitment to, supporting, some of our most vulnerable New Yorkers. So we can follow up with that as well afterwards, so you can see some of the things that he was talking about.
Okay, Robert?
Yeah, hi, Mr. Hansman. I'm going to be calling New York City well in the morning about a particularly obstreperous case. It's been going on for several years. I'm not going to get into the details about it, but this is a young man, 28 years old, and his mother's a friend of mine, and he's bipolar, heavy marijuana user, and I would say maybe 40% compliant with his medication. He's been hospitalized several times. He left New York on his own, went up to Binghamton to a program that's up there, an employment tie program. He misbehaved and they put him out. Then he went up to Oswego Mental Health. And he stabilized for several months, and his mother was quite happy. And he walked out. He's back home now about 3 or 4 days ago. It's sheer insanity. Now, my question really is, to what extent can the counseling staff cohere to a particular need? This fellow, and I know I had met him, and I coached him to, very bright young man, and he got his real estate license. He wasn't able to work several years ago, but he did get his real estate license. So he's that kind of intelligent fellow. And so what I'm concerned about, his mother's reached the end of her rope. She just can't. Can you stick with a particular case? Do your counselors have case loads, as it were? And because this man is fixable, as far as I'm concerned, but his bipolarity is serious, very, very serious.
Yeah, that's a wonderful question. So NYC Well doesn't necessarily have a caseload in that way. What NYC Well can do is help get that individual connected to broader services. So obviously individual cases are tricky. There's all sorts of complexities around them, but in cases like these, you might see them recommend a higher level of treatment. So it could be Connect, which we just launched. It could be something like an assertive community treatment team, which can actually provide services in the community for someone who doesn't really adhere to outpatient treatment well for any number of reasons, right? So, and they can help with medication management, with therapy, with treatment. It will be in this how to help guide as well that I'm gonna distribute, how to get someone connected to teams like this and this higher level of support that we know many vulnerable New Yorkers need, right? The outpatient model works for many people, but there's many folks that it doesn't work for, and there are other treatment alternatives for folks like that. So absolutely call NYC Well tomorrow. They're definitely your first step to getting that next level treatment and how to get someone connected, and can give support to the family as well.
Yeah, it's available in Spanish. We'll they'll be able to talk to his mother in Spanish?
Yes, absolutely.
Yes.
It is available in English, Spanish, and Mandarin Cantonese with, proficient language, and then in 200 additional language through translation.
Excellent.
Okay.
Thank you very much.
Yeah,
Thank you.
so we appreciate your presentation and work you do. Just want to bring one thing, you should bring one thing back. We have 3,000 residents of Douglas houses that are in 10025, and they always get short served because they happen to live in 10025. So maybe there can be some extension down from the 25th to the 24th. Just a suggestion in terms of precincts. But thank you so much.
Our pleasure.
Okay.
Thank you.
Shelley, I think we do now
Yes.
have Mark Levine here.
I saw the name, and we also have our chair has been with us, but there's on the screen, Steve Brown.
And
And
unfortunately, I was
Mark?
on route and now I'm in front of you. So it's,
Okay.
sorry, I couldn't talk too much before.
So our Honorable Manhattan Borough President, Mark Levine, is here with us this evening. We know he had a very busy schedule, so we welcome you.
Well, thank you, Shelley, and great to see all of you. I have to say, CB7 has been just a leader on health issues throughout this pandemic and on mental health as well, and I'm really grateful for that. Of course, my heart is extremely heavy right now with the tragedy in Texas. I'm sure it's come up in your discussions already. It's kind of hard to think about anything else, but suffice to say that we have a lot of work to do in this country, and I hope that at last we will come to our senses on guns. But bringing the topic closer to home, I'm really pleased to have a chance to talk about one of the biggest challenges facing Manhattan and New York City and CB7 for sure. I really think that the mental health crisis has to be considered along two tracks. We have the broad challenge of the mental health impact of this pandemic, the ongoing challenge of depression and anxiety that predated the pandemic and has been exacerbated, the alarming level of suicide, including among young people. And the deputy director spoke powerfully about the resources that are available through NYC Well. I'm not sure the extent to which he spoke about in-school resources, but what our young people have been through over the last 2.5 years is trauma. And what we know about trauma is that it often hits you when the crisis phase is over. You hear that from soldiers who are coming out of combat, for example. The most difficult mental health challenges are often once they've come back home. And so I think we need to prepare that our young people are going to have months and years of challenges in overcoming the trauma. And we had insufficient mental health resources in our schools pre-pandemic. And it's now more urgent than ever that we both expand the number of social workers. But not only that, social workers are not the same as therapists or psychologists. We need a broad category of staffing expanded in our schools to deal with the challenges coming out of the last few years. I want to speak a little more time devoted to a second track of challenges, which is the more acute psychiatric conditions that we're seeing playing out on our streets. Just the terrible human tragedy of schizophrenia and bipolar syndrome that really, I think we have to acknowledge our mental health system has been woefully inadequate in addressing. Prior to the pandemic, we lost almost 500 psychiatric beds in Manhattan. That number was probably close to matched again in beds that were converted during the pandemic to deal with the COVID, and that's understandable. But we've lost that capacity now, and increasingly it's our public hospitals who are shouldering a wildly disproportionate load in serving people with mental health challenges. And this trend has to be reversed. It is far too difficult to get an inpatient psychiatric bed in Manhattan right now. It's the wait, even for those who qualify, can be months. And once patients are in, they're often pushed out, even if they're not entirely stable and not ready to return to their communities. We need intermediate type facilities, medical respite beds that are designed for psychiatric patients. There are a grand total of 21 psychiatric respite beds in the borough of Manhattan. That's the number. And so often individuals who are not really ready to return to their community have no alternative because there's no respite bed available. But we also have to expand innovative models that give an individual a chance to stabilize for 24, 48, 72 hours without needing to go to an ER, which, by the way, is about the worst place you can send someone who's having a psychiatric episode. And there are great models like the living room model, the clubhouse model. These are often peer-led. They bring a whole panoply of services, everything from not just straight up psychiatric care, but nutritional services, employment. And we have a few of these facilities. And then there's the outreach that I feel the city just has not gotten right yet. The outreach to people who are on the street. There are good models. Some of you might know the Midtown Community Court, which has a phenomenal outreach program where they really build relationships with people on the street. It's much more than a quick point of contact, which is the typical way the outreach is done. They get to know people, they get to know their names, they build relationships night after night. They offer them water and clean socks, and they've been remarkably effective at bringing people in for services. Again, this is Midtown Community Court. We're trying to get them more funding to expand and replicate the model borough-wide and citywide as well. The ultimate long-term solution that this board knows so well, because you've led on it, is supportive housing. And one of the projects I'm most proud of in my time in government is the project on 108th Street. Shelley, you of course were in the lead on that. So many of you here. Audrey, you were a huge supporter. That's 200 units that we desperately need, but we're far, far behind. The waiting list on supportive housing can stretch into the years. So what I've outlined really is an end-to-end model for dealing with people who are most acute, dealing with the most acute conditions. It starts with outreach, often on the street. It moves to connection to services. It moves to the appropriate type of care, treatment, whether in a short-term setting or inpatient, and ultimately it's supportive housing. We have more work to do in every category, and these are issues I'm working on in my office using my leverage in legislation and budget and advocacy and more. So I think I'm going to pause there. I don't know if there's time and space for questions. If there are, happy to take them. I know you have other speakers on the agenda, and then I'm unfortunately hopping between a long list of meetings tonight as well. But I'll turn it back to you, Shelley. Thank you so much.
Okay, great. Thank you. You want to take I think you covered the whole spectrum of what we're concerned about. There are a couple of questions. Let's see if we can get them. Peter, and then our chair. Okay.
Sure. Thank you. Hey, Mark. Good to see you.
Great to see you too, Peter.
I will say that I was primarily going to direct this toward the mayor's team, but our area has a high concentration of mental health providers. We have a number of organizations that are working in this neighborhood. They are their work is made more difficult because of some of the inability to make connections between them and the police. so that when the police respond to people that have problems, they end up going to the hospital, and it's the connections are not being made to the the long-term care connectors. I run into this regularly where I have to explain to the police why a person needs help, even though they haven't, hurt anybody yet. They're acting in a way that, and they have a history, and it is not an easy thing, and it needs to be addressed, and it's and I'd love to see that happen more.
Yes, absolutely. I'll just jump in for time. Did
Sure,
you get to the
thanks.
heart of your question? Okay. Well, first, the police aren't always the appropriate responders to mental health crisis. If the individual is not posing a threat to themselves and others, as is not always the case. And there's a wonderful, very successful pilot. I think I'm not sure if it's now touched CB7. It's currently in CB9 and 10, called Be Heard, where the 911 dispatcher can send out a team, a 3-person team. It's 2 EMTs and a social worker, not a police officer, in cases where the 911 dispatcher determines that there's not a threat of violence. They have been remarkably effective by almost any measure. And that needs to go citywide. There's something new rolling out nationally that maybe someone spoke about tonight. It's 988 as an alternative to 911. Don't know if you've spoken about that. The idea is that you could have another quick 3-digit number you can call in an emergency when you're not looking for a police response. You're looking for the kind of mental health response I just described. And New York State is now going to be rolling out 988, I think in the coming months. I don't know the exact timing. So that's a little different from the Be Heard pilot, because it would allow you as an individual making the call to just determine that, look, I just need a very quick mental health response. I don't need police response. But in cases where there's a police officer involved, yes, we do need, I think, additional training on how to de-escalate and how to connect to the right kinds of services. So I think there's a lot we can do on emergency response. And I mentioned some of the promising models that are now gaining momentum.
I'll look forward to the Be Heard making it down into our neighborhood. It doesn't exist here now. And right now, the police are, the 24th precinct is fairly well trained and has been fairly responsive, but it is difficult if the police, if somebody doesn't want to deal with them. So thanks.
I think we lose out because Manhattan Valley isn't generally in 10025. And if it was in, had a different number zone, we could get a lot more. So maybe
they're rolling out Be Heard by precinct. So I guess it's in the 2-6, which is just north of you.
Yeah. Okay. One more question. We know you have a tight schedule. Our chair, Stephen Brown.
Thank you, Shelley. And just acknowledging Shelley and the work that the HHS has been doing. And I know Mark can attest, I brought it up at Borough Board several times with an emphasis on mental health. I'd have a quick comment, then a question, and the comment more is I like the way that you frame things, and I'd reemphasize when you talk about kids in school. And the thing that I've seen with my own son is there's sort of the kids that have a lot of problems, or the kids that sort of are at the higher level. But I think I've learned that there's a very subtle thing. And I think what I've seen is, and I'm dealing it right now with my own son, is just a level of almost antisocial. They have been isolated for so long and now they're back together. But in the relative scheme of things, the way that I traditionally experienced high school, and perhaps we all did, it's still a fraction, and I undervalued it. And when I talk to other parents, I can't tell you how many times I've asked my son to invite a friend over and he says, well, he doesn't want to come over, he's at home. And I'll talk to the parent, they're like, yeah, he's a little isolated. So I think there's a lot of subtlety in that. And I don't know what the answer to that, but I wanted just to say as a parent, I see that a lot. There's a lot of isolated kids who are not as social, and it's really hurting the fabric. And I do think it's bringing a level of depression and anxiety and things like that. And I don't think I noticed that last year, but I noticed it this year as a parent. absolutely. And dealing it with my son and his kids, it's been something over the last couple of months that I've noticed. So I'd emphasize that and of how to reach that or just put that in your head. And then the second part is more of a question. Look, for me, there's a lot of different things. I think what you talked about was beds is where it starts. And you know, I think the quickest way, if we can get more beds, whether it respite beds or other beds. So how do we get more beds? I mean, is that just about we're going to get to it in the budgeting this year? And then how does CB7 help you to get these things? Because one of the things that HHS and Sheldon does really good is write resolutions. So because I read them. But what can
well, first of all,
because
you know,
we need more beds. We need an investment.
Yes,
we need a physical investment in this. So what can we do to help you, and how do we get more budgets for getting these things?
First, thank you for speaking about your own family, and it's something I hear all day, every day, and experience in my home as well. And this has been a rough 2 years for young people. I think we have to speak about it publicly. I think if there's any upside, it's that I think the taboo of mental health is being lifted because everybody is dealing with it. There's no family in New York City or America who's been untouched by the mental health challenges of the last 2 years. And so I just hear more talk about it, hear more talk about it from colleagues in government, far more than I ever did before. There are multiple culprits for the decline in beds. The way that Medicare reimburses really disadvantages psychiatric care, and so you know, to put it bluntly, hospitals lose money on those patients just because of how the billing and reimbursement works. Now, Governor Hochul has made some announcements in the budget that was passed about a month ago to improve that I think will help. I think we need to also advocate directly to the hospitals. It cannot just be public hospitals that are shouldering the burden. Before the pandemic, they already were serving more psychiatric patients than the rest of the city combined. And I don't know the latest number, but it's gone way up because of the dynamics that I was explaining before. When I talked about the loss of beds, that was all in private hospitals. That was not in our public hospitals. So I think, you know, advocating to the hospitals locally to I don't know if there's any actually in CB7, but there's many that serve CB7 for sure. I think some of the kind of intermediate models I described, I use these terms like living room and clubhouse, which we probably don't have time to get into, but you might know about them. City funding can go into that as well, city and state funding. The health commissioner today laid out a vision, which I haven't had a chance to review the details of. I don't think it went into a lot of policy specifics, but he ran one of the best organizations, Fountain House, which has this model where people can drop in, they get intensive care, peer driven. Eric is reminding me that Mount Sinai West is in Community Ward 7. So there you go. So I think you have
like a tip of Mount Sinai West, but I think it's right there.
Look, anyway, I think you need to direct your advocacy at all levels. Medicaid has to be fixed the way it bills. The state, that's largely driven by the state and also the federal government. The city and the state need to put more money into the interim facilities. Those are nonprofits. They get a lot of local government funding. I think just by speaking up and naming it and raising the alarm on this, I think you'd help a lot. So it would be wonderful if this committee, as it has throughout recent years, could lead on this. I think it would have a big impact.
Great, thank you.
And we're going to do it two ways. We have our next speaker, who is the chief of staff for Sean Abreu, our council, one of our council members, who's on the mental health committee. So we're going to get some insight there. And I'd like to point out that Audrey and I are on the Manhattan West, Mount Sinai West Community Advisory Board, and we will bring it up as a topic there and maybe bring them on here. So
that's great. I'm sorry I have to run. Wonderful that you're hearing from Amber. She's wonderful, as is the council member. So you're in good hands. Thank you to the HHS committee for inviting me,
Okay.
and for your continued work on this. Really appreciate it.
Thank you so much.
Have a good night, everybody. Bye-bye.
Okay, good night. Okay, Amber Moore, a pleasure to have you with us. And we saved the best for last in that, in many ways, because the council is where something may happen, okay, in June. And it seems that it's more getting down to the nitty gritty of what's really going on there. So please share with us.
Sure. So thanks so much for having me. Sean was very excited that I was going to be here with you all tonight. He loves talking about mental health, and obviously it's been just a really big concern across the city. So really grateful to have had the borough president and the mayor's team here tonight to talk about a lot of the plans that have been going on. You know, honestly, listening to them, you know, it's striking that it seems like our focus is really trying to, for the first time, be comprehensive in how we think about mental health. And that goes from trying to focus on preventative measures. So one of the big things that we've been working on is trying to bring more full service community schools into the district so that students and youth are set up and have access to mental health sources before they reach a crisis point, but also having those resources for folks after they reach that crisis point, and making sure that we're taking them very seriously, and that we have real resources for folks at any point in that spectrum. So that's really where the council's been thinking. For us, you know, coming up right now, we are nearing the end of our budget season. And so we can't say for sure exactly what's going to be in the budget at the end of the day, but there's a lot that we've been fighting for. I know that this group has been following Councilmember Eric Botcher's plan for a comprehensive mental health approach, which we are huge supporters of. It really takes that comprehensive element of getting all groups of folks support where they need it and when they need it. And we're very excited to see that taking shape and coming closer to being a reality. We you mentioned that Councilmember Abreu is on the Mental Health Committee. He's also chair of the State and Federal Legislation Committee. And so what we've been doing is we've been doing a lot of joint work with the Mental Health Committee and Chair Linda Lee. Because a lot of what's holding us back in terms of what we're able to do as a city on mental health is a lack of coordination with the state. There's a whole web there of what resources are provided by the state and which are provided by the city. And there are folks who don't get access to resources because we miss those connection points. So that's one thing that we're working to untangle over the next year. But as far as the budget goes, some big ones that we're excited about is $14 million that we've been advocating for mental health counselors and guidance counselors in schools, $115 million for safe haven beds, and of course money for Be Heard, which we've heard so much about tonight. And as everyone keeps saying, very unfortunately doesn't quite get down to CB7, but it is in Council District 7, Sean's district, for the first time, and we're very excited about it and talking to the mayor's team about it regularly, and really want to see it spread all the way down through the district and across the city, really. But yeah, so that's the big things on our mind that we're focusing on mental health. And I'm happy to try and answer any questions that you might have.
Okay. You tell Sean that they shouldn't do it by precinct. They should do it by council district.
Exactly. That's what we think. We don't pick favorites in our district.
Right. Appreciate that. Madge, question? But you have to unmute.
has there been feedback from the VHERD program? Do you have results? Have you been able to measure what's happening? It sounds so promising.
I believe, let's see, is Jason still on or from the mayor's team? Oh, I think they're off. I know that they have shared some data. One of the biggest data points that have made us optimistic about the program is more folks who call 911 with mental health issues are accepting help. So, you know, that when you send the right people, they say like, yes, like you're correct, I need help. And I'm willing to welcome you into my home. I'm willing to talk to you about what's going on with me. So it's still early in the program. So, you know, we don't have like necessarily our long-term data yet, but we're so excited to know that it's having, you know, already that impact.
Thank you.
That's good. That's good. When do we find out what's in the budget or almost in the budget?
In the next couple of weeks, you know, the fiscal year ends June 30th. So we got to be ready to go right by July.
Will we have any way to get a preview of what may be there?
You know, I'm glad you asked. I have a link for you all that I'm going to put in the chat. And this is from...
There's no chat.
Oh, no, there's no chat. Okay. Well, I will send it to you after.
This is Max Vandervliet, the district manager. You can email it to me and then we'll distribute.
All right, perfect. So I will send to you all a link that includes our hearing with the Finance Committee of what we're thinking about doing for funding for mental health. And it includes our reports and minutes from that meeting of, you know, what different council members are advocating for, what different organizations that work on mental health are advocating for with the city council.
Super, bingo. That's great. That's great. Thank you.
Sure.
That'll be very helpful because if we could see what's going, we could say, why isn't this happening? Oh, great. Let's see if we can push on that. Who do we have to, where can we put the pressure? You know?
Yeah, absolutely. Absolutely.
Okay, great. Thank you so much.
Sure thing.
Okay.
Have us back anytime. Really, really grateful for the work that you're doing. And, you know, the more that you guys can do to bring attention to mental health, the more power it gives us to go out and fight for all the things that we've talked about tonight.
Okay, let us fight together.
That's right.
Thank you so much. Best to Sean.
Sure thing.
Friend, thank you. We're going to have one more thing, which I think won't be difficult to get through. It's really a follow-up on the food insecurity. We talked about legislation and issues to promote, but want to get down to, while the budget season, to push for certain budget issues. So I put together, what do I have to do? I have to, let's put that down. I'm going to need a shared screen. So I'll do this shared screen. That's not the shared screen. How do I get shared screen?
It should be a green button at the bottom of the screen, Shelley.
At the bottom, I have that shared screen.
So you click on that and then it should show you your desktop and then you pick the file that you're looking for.
Oh, sure. I do it all the time. I do it when I tutor. I don't know why I think, okay. So let me see if I can expand this. Everybody can see this?
Yeah.
I'm not going to read the whole thing, but the introduction basically is that we want to count the food insecurity within our catchment area, Community Board 7 area. And there's a need to distribute more healthy food, sign up more customers in need with essential food benefits by funding expanded community-based engagement. And I'm not going to read it, but basically there are programs that need to be coordinated by the Mayor's Office of Food Policy. And although we've been told in the preliminary budget that certain things might happen, there was nothing about the funding for continuation of the PFRED PASS program, which we learned about in our food insecurity meeting. So just to go through the things we're going to be voting on, that we request Mayor Adams and the City Council to support and fund through the New York City budget, West Side Campaign Against Hunger's efforts within Community Board 7 catchment zone to distribute more healthy food and to sign up more customers, etc. And we got a dollar figure from them because they always say, well, what do we want? You know, what should we advocate for? They said if they had $125,000, they feel they could accomplish that. Furthermore, request that Mayor Adams, City Council members via the West Side Campaign Against Hunger, which is really coordinating a lot of what's going on in this area, to support the roundtable Allies for Food Access, the different agencies that work together, a dedicated network of emergency food providers, and they need $45,500. Both of these requests seem very reasonable, okay, and don't seem to be something that should be controversial. Furthermore, we request, this is a biggie, Mayor Adams and City Council members to increase funding with an additional $63.5 million to the Emergency Food Assistance Program, EFAP, into the baseline budget to accommodate the increased cost of adding fresh food into the program and continued need. It's not just food, you know, fresh produce and fresh food. And furthermore, there are two more. Urging the mayor and the city council increase funding for EFAP beyond its current baseline level of $23.8 million to a total of $87.3 million to account for the loss of the PFRED and adequately fund this expanded effort to make fresh food, which is more expensive to purchase and distribute than shelf-stable food. And because it's what type of food, you know, it's very nice, the shelf-stable food, it's good, but we can do better. Furthermore, be it resolved that the community board urges the mayor and the city council members to increase investments in the mayor's office of food policy. While there was an additional $3.9 million included in the funding year 22 city budget to hire 7 staff members for that agency, there was no additional funding allocated towards the office in the funding year 23 preliminary budget. Unless there's activity there, things don't happen in the city as well. And that's what all the agencies have told us, and emphasized by West Side Federation Against Hunger. So, when West Side Federation, have West Side Campaign Against Hunger. Any questions about that or comments? Mark, please.
Thanks. No, this hits the nail right on the head as far as I can tell. You're the expert, but it really does address all these things. Among other things, it's responsive to what we heard at a previous meeting from the West Side Campaign Against Hunger's Chef Silverman, who was talking about the difference between the Get Food program and the Get Calories program. The focus on healthy food is really the thing that we should be focusing on, and that's what your resolution does. In the last point about expanding the mayor's office of food policy, one of the things that might be worth either a mention or consideration going forward for your DNS section or whatever is learning lessons from pandemic, so that the Office of Food Policy is ready for the next one. Because as sure as we're sitting here tonight, there's going to be a next one. And we should be profiting from the experiences we've had so far. So I don't know if that means that instead of the 7 people they added, they should add an 8th, or whether they should expand that, but maybe some reference to the institutional learning and legacy before all these guys go off to work for President Biden, to make sure that we retain the experiences and the learning.
Okay, we can fit something in like that. That sounds good. Normally, we don't do budget items. We were trying to look at our DNS. We've been talking about that, and eventually the budget priorities. But I kind of feel that if we can get this in and push it a little bit, we'll have it for this coming, fiscal year, instead of waiting too long. Food can't wait. Good food can't wait. So, but in the meantime, we've done some of the work for our DNS and budget priorities. Any other comments, questions, or does someone want to move the resolution? Okay, Sara, second. Madge, all in favor? Committee members, raise your, okay, 1, 2, 3, 4. Audrey's no longer on. Okay, it isn't, we do have a majority that we need. And non-committee board members. Okay, we have 2 and we got 2. Okay, so we're done. Okay, I think I'm going to push. I was very glad that Amber was willing to give it. What I hoped we would have tonight was what Amber said that she would give us, which is, what are they doing? What are they pushing for? To see if what we asked for is in there and to what extent and how we can further support it. So it looks like we're going to get that. And I think if we get that, we can promote that and push that with all levels, from the mayor and the council. Because it's by June 30th, by mid-June, the whole budget thing's going to be over. And if it's not there, we won't see it. So in the end, resolutions are important and identifying things are important. But if it's not monetized in a timely way, then we're back where we were, or worse. So it's a great, I have an announcement to make, okay? But I'm gonna do it in a picture, which if you can't see, I'll tell you. Okay, it's a personal announcement. Okay, just 1 second, please. Indulge me. Come on. Here we are. Can you see that?
A new baby?
Yeah, that you have to understand that my wife and I got married young, and we're blessed in 11 months afterwards to have our oldest son. He got married young, and in 12 months, 13 months later, they had their first child as a son. Well, that son and his wife last night gave birth to that child, who looks about 2 months old at birth.
She's a great-grandchild?
That's, yeah, it's crazy. It's a great-grandchild.
Congratulations, Mazel.
Thank you.
Congratulations. I must be psychic because I said he's going to show a picture of the grandchild.
It's
and there you are.
Now you can be formally the great Shelley Fine, which we all know you to be. Well,
that's what our grandson's wife said. You're a wonderful grandpa, because she never had grandparents. Wonderful grandpa. I want to make you a great grandpa. So I said, I'll try. I'll really try. She said, no. I said, what? I said, I couldn't conceive of that. She said, you didn't have to. I didn't. I made that up, The first part was right. The last part was mine. So it's mind-boggling, because whoever thought, everyone I know who's a great grandparent is 90 years old. If fortunate, but we've been blessed. So I will be gone for about 5 days, 5.5 days. We're flying to Israel. They don't live in Israel, but he's a rabbinical student there. And so he's there. So we all have to go there. And then we'll come back, and he and his wife will be coming back to New York. And he's been hired as the rabbi, and she, the Rebbitzin, the rabbi's wife, but an actual position at Stern College for Women on 34th Street.
Oh, cool.
So they will have their best babysitter within an arm's reach.
Oh, great.
Congratulations.
Mazel tov.
Thank you. So I'm glad, was glad to share it with friends.
It's a wonderful.
Congratulations, Shelley.
Thank you, thank you, thank you. Everybody have a good rest of the week. Onward and upward. Let's keep doing good stuff, and we'll get the, yes. And we'll get, right, we'll get that information out to everybody as soon as we get it from the, from Amber. And I think individually we can advocate, but we'll do it together too. Okay. Okay. And thank you
all. Good
Mr.
night.
Chair, for joining us tonight.
Thank you.